My name's Aly. I'm 14 years old and I go to Dobbins Bennett High School. I like to play softball and spend time with my friends and family. I like baking and reading. Well, I tried soccer, cheerleading, basketball, but I never really enjoyed any of that. But when I tried softball, when I was 4 or 5, I loved it. And so I've just been doing that ever since I can really remember. I remember that day I was with some of my friends and we went on the golf cart. My dad called me. I answer. He's like, "What are you doing?" I was like, "I'm about to go on the golf cart with my friends." He's like, "Okay, just don't go on the nature trail." And then we went on the nature trail. So we went off the road, the trail for a minute. And when we went to turn around, we were going kind of fast. And the tire went in a hole and it kind of just flipped over on my side. And it was like a blur. 1 second we were driving and the next second everything was hurting. And I look down and I see my leg and I'm like, oh gosh, that's not good. So I'm screaming, I'm freaking out. My friends, they stayed there, they called 911.
I was on call the day that Aly suffered her injury. I saw her in the emergency room. It was clearly a severe injury. I took her to the operating room to wash it out, get dirt, grass, everything out of it. But it was clear that part of it was the flap that had been created by the injury was not going to survive. I contacted Dr. Billington for her help as a plastic surgeon.
Initially, it looked like it was just going to be a big scar. She was done playing for last season. We knew that, and then she would be fine and get going. And after, about by the end of the first day in the hospital, after I got there, started realizing the severity of it and the possibilities of what could happen if things didn't go certain ways. Was very concerned at that point. And the first couple of days being told to, in the hallway to prepare for possible limb loss, that just couldn't even wrap my mind around that and process that.
I met Aly on injury day 4 and was able to assess the wound with Dr. Taylor, and I agreed with her assessment that there was a significant part of the wound that looked like it was probably going to not make it. Initially, coming in and meeting you guys, I had to come in and say, no, we're gonna have a really big surgery here and you're gonna be in the hospital for a little bit.
And when Aly came in, I was quite concerned about not only her physical injury, which had turned her life upside down in a moment, but how this young, active woman would react to having a disability for a while until her leg could be reconstructed. But I knew we had an excellent team. We have board-certified emergency room physicians, board-certified intensive care doctors, and I knew that she would get excellent care at Niswonger.
We have a team that comes together. It wasn't just a surgery, it was the people that brought her in, it was the emergency department who helped triage her, it was the incredible nursing staff that was there to hold her hand, it was Child Life who came in and were able to distract her when I had to do some dressing changes. So I am so thankful for the team approach. It's where I would want my daughter to come if she had an injury like this.
And this past year, I recovered quick enough. I was able to go play for my school team and we went all the way to state and got runner-up, so it was really cool.
Whoa!
I'm trying to catch you because you...
From the initial intake in the emergency room and all the way through her first surgery, and we had phenomenal care. We really were fortunate to have the doctors and the nurses that were in it for all the right reasons.